All right. Just gonna wait for Megan to check in here. Hey, there you are.
Hello.
What's up?
Nothing, just trying to get the whole setup happening at my desk here.
It's easy for me because I have this set up like permanently.
Yeah, that's nice.
Sometimes I get to my emergency visits and people are like, why is the tripod set in the back? I'm like, I promise there's no weird stuff going on.
Yeah. No kidding.
I promise. I'm just gonna shut the blinds in the back here
Okay.
quickly. There we go. That should be good. I had to dress up today because I'm like interviewing somebody.
There you go.
A practicum student. So I'm gonna try to do this practicum, like I guess a remote practicum.
Oh, nice.
I'm gonna turn up my volume. Hopefully it doesn't end anything. Okay, we're good.
I guess that's what the world we're in now, virtual interviews and stuff. I think more people will do that.
Yeah, I think that's the way it is. And I was like thinking of ways. I'm like, it might be hard to fill out 40 hours a week. And then I thought of all these things. I'm like, I could make this person work 80 hours a week.
Yeah.
Hopefully they're not tuning into this. We'll see how the interview goes. Because even these like live things take some time too.
Yeah, totally.
Like that recovery one was hours and hours and hours of work. And then now I looked at my library of articles and it's nuts. I have so many things. And I can just tell patients, be like, hey, check out the postnatal video or check out the recovery video or check out the shoulder video. And I could just charge them for YouTube videos. I could just sit at home and not be a physio anymore.
Don't let out all your secrets.
That's true. Oh yeah, I got to keep them for me.
Yeah.
Any fun plans for the weekend? Apparently it's Friday.
Yeah. No plans, but it's my birthday on Sunday, so.
Oh, it is? Oh my gosh.
Yeah. I'm at the age where you just don't remember how old you are anymore.
Oh my gosh. That's what you got to do, like something special, some sort of isolation birthday.
I don't know. I'll have to ask Quinn if he's got anything.
I'm sure is he romantic? Does he like doing that kind of stuff or?
I don't know. Is he watching?
Okay. I don't know. That's why I was hoping he was.
Yeah, in his own way. So yeah.
Okay, well that's good. Well, that's good. I like putting people on the spot, so maybe that's why I don't have that many friends.
Well, it'll probably be like a yard work birthday, a yard work and
oh, yeah. It's supposed to be nice, right?
Yeah. Yeah, except it's like exciting now. It's like you hit 30 and it's like, oh, yard work. It's like cool.
Yeah, even me, I'm just like every spring or whatever this season's called, I sweep the garage and wash it and scrub it.
There you go.
It's such a satisfying feeling after, and I'm like, yeah, I'm getting up there in age too, I guess. And I'm like, I gotta get the old patio furniture out. So.
Yes, exactly.
Oh well, I'll get it done. It's such a pain because I live in I have such a weird home. It's a townhouse, but it has no direct access from the garage from the inside to upstairs. So you have to go outside. So then I have to carry all my stuff from the garage in through the house, up the stairs, and then back into the deck because the deck doesn't have stairs going down. So.
Well, once it's out there, and you can be comfortable and just like sit and enjoy. And
yeah, and then I can just hang out in my social isolation time. One person that says, thanks for doing these videos. No problem. No problem at all. And we have a YouTube channel, so check out our YouTube channel. To everyone, subscribe, send it to everyone you know. Let's get some revenue off this YouTube.
Yeah.
I think you need like 100,000 views or something like that to get it.
Oh, do you? Well, just direct clients to there. You'll
It's hard though. I feel like physio is not like the, I don't want to say this, so not to offend physios, but like on YouTube, not the coolest thing in terms of like, I can't do dances and stuff like that or that TikTok stuff. Especially when I say TikTok stuff, that makes me sound a lot older.
Yeah.
Because I think we're the same age, right? Yeah.
Yeah.
Yeah, we're the same age.
When am I turning? I'm turning 32, I think. We're the same age.
Yeah, so 88, right?
Yeah.
Yeah, so we're the same. Wow. Look how
Yeah.
much more mature you are than me. You have
No, well,
family, you have a stable home.
hey, you have starting a business under your belt. That's pretty cool. That's pretty big.
During COVID times, I'll have a lot of things to say after this. I should do like speeches of how I
Oh,
keep
yeah.
my mental well-being throughout all this, whatever's going on. So, yeah.
One day when you're a grandfather, you'll be able to tell your grandkids how you lived through the great pandemic of 2020.
I plan on never dying, so I'll tell my great kids, great grandkids, like great, 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 great.
There you go.
The legend of me, who is still here. Yeah.
Exactly.
Pass down the empire. So, yeah. Thank you for like doing all of this. I know it was a bit of work, and I know we've been exchanging some emails and stuff, and I think it's quite a bit of fun to see how this presentation came to be. So, thank you. Thank you, Megan, for doing this.
No
And
problem.
and to everyone, this is Megan Kroschinski. She's a friend of mine and a colleague. So we met at an Olympic weightlifting gym. That's kind of where I met you. I was intimidated initially because you lifted a lot of weight, and I may have been insecure about how much I could lift. So that's where we met. And I'll let her introduce herself and everything. So I do thank you immensely for coming on and doing this with us. And I really look forward to learning something new as well. So thank you.
Awesome. Well, thanks for having me, Sunny. And I really, I've been really enjoying the videos you've been putting out here on Instagram Live and stuff. And it's really good to just like open up your mind to like just different topics that I am not always privy to. So even yesterday, the running stride one was really interesting. I listened to that one, and yeah, it was just really cool.
Yeah, I was blown by that.
So yeah, I'm Megan Kroschinski. I am the Mind, Body, and Special Populations Programmer at Service Place in St. Albert. So a little bit about my history. So I have a Bachelor of Physical Education at U of A. I've been in the fitness industry for, I think it's 12 years now.
Yes. I will show that in writing for people here.
Yeah.
There we go.
And just, I'm NSCA-CSCS certified, AFLCA, CSEP-CPT, and Fit for Two certified. So I've just, the fitness industry is just where I've loved to be and will probably be for the rest of my life. So it's been fun learning about that. And yeah, I'm so happy I get to like talk with you today about the postnatal fitness. So a couple other things. I am a mom of one, so I actually have a little bit of experience with fitness while pregnant and postpartum fitness as well. And I've worked with a number of clients over the past 5 years, pregnant and postpartum. A lot of like history in the athletics area for me. I've played high level hockey, rugby, Olympic lifting, soccer, wrestling, lacrosse, a lot of different sports to pull my experiences from as a trainer and strength coach. And then, yeah, I mean, like currently I've just been trying to stay fit and active, a lot of walking, running, like what everyone's doing right now, and then yard work. But like overall, like we'll be talking today about like pre and postnatal fitness and just like special populations that I like working with, such as that. And I've worked with a bunch of different special populations. So people living with Alzheimer's, dementia, Parkinson's, MS, and all populations. So, but today specifically, we'll be talking about postnatal fitness and just the journey back to your regular strength routine or your regular fitness routine in general. So, yeah.
Brittany just joined us, by the way.
Oh, hello.
Yeah, so she just joined. So this will be great. Sorry to interrupt. That was rude.
No worries. No worries. Her Instagram Live was what inspired me to reach out and actually want to talk about that journey back to fitness and, you know, that being cognizant of just the changes your body has went through and just things like pelvic floor health, going back into, you know, your regular fitness journey and the time it takes to get there.
Mm-hmm.
Yeah, so it was really inspiring to start out with. So, and Sunny, I don't know if you want to talk, when you want to kind of talk a little bit more about, oh, I see, never mind. I have the slides open in front of me as
I can talk about it later, yeah, whatever you like.
So yeah, so as years have progressed, I really dived into pre and postnatal exercise specialty. I got a certification in that back in 2015, and I've just really loved working with that population even before I got pregnant. So it was just it was an area that I felt like maybe the fitness industry in general or the recreation center, like the recreation center that I've been at, or even other gyms I've worked at, maybe it might be lacking in specialty. So I really wanted to dive into it a little bit more and encourage a lot of the staff around me to dive into it more, because first of all, we all have pelvic floors, male, female. You know, many of the females in our lives will be having or have had children, no matter what age they are. They're still on you know, that journey of like, you know, staying fit and healthy. And as you're postpartum, you know, your fitness journey back to your regular routine, you know, it might take 8 months, it might take 8 years. Like it's so different for everyone. And I just felt like that was so important for like myself and my team to know and be educated about. And it really inspired me to dive deeper into. And, you know, there's so many women that, and just society, you hear the term like the bounce back, right? Like you're just expected to bounce back and just be where you were initially. And that's not always the case either. Like you are dealing with a lot of changes in your body, and you know, your body may not ever be the same, but it's like, how can we get you back to that area of functionality, to where you can do some or most of the things you were doing before, and how you can do it effectively.
Yeah, that'd be tough, because like that's one thing, for instance, I'll never be able to understand because my biology and anatomy. And you hear about it all the time, like people just saying, oh yeah, just get back into it. And it's like, well, no, it doesn't work like that. So should be like some sort of gradual progression in activity. And it's good because you get to speak firsthand on that, going through the process yourself. So yeah.
Yeah. And I think too, you know, a lot of people, especially if they love fitness and maybe they stayed active during their pregnancy, you know, once they're 6 weeks postpartum and they've got cleared by a doctor to get back to some sort of physical activity, you know, like they're revving to get back at it. And
yeah,
what I sometimes have to explain to people is, like pregnancy and birth is a beautiful thing. Things happen, things change in your body. You almost have to compare it like a muscle pull, like an injury in a sense. Like, so if you were to pull your Achilles tendon, the thing that you're going to do the next day is not run stairs. You're not going to go run stairs.
No.
You're going to rest it, you know, make sure it's feeling better, and then slowly work your way back into, you know, that flexion and extension around the ankle. Wow, my tongue tie there. And, you know, eventually into dynamic movement. You're not just going all out right off the bat. So, and that's kind of the same, but on a bigger scale with pregnancy and birth. You know, you got to start at you know, the rest and recovery, the healing stage, and then you're going to slowly progress back into a point where you can get to that more dynamic movement with comfort and not getting more making yourself more injured in certain areas. So
yeah, those are good points.
Yeah, so I guess we will go, let's go to the next slide there. Just for a little bit of an anatomy review, and I really loved the anatomy review that Brittany had done in the pelvic floor physiotherapy talk, and just kind of showing, well, this is a little bit more of like the pelvic girdle area, you know, the soft tissue organs that would be in that area, bladder, different areas of excretion down there, like the organs that pelvis is holding and that pelvic floor is helping to hold in. Mm-hmm. So I won't go too in depth in those ones. And then coming along to just different areas and layers of the core. So a lot of times you've got trainers or group exercise instructors that they'll rely on saying, you know, this is where we're going to work your core, you know, and it's always like core. Well, what is the core? What is it made up of? And that's as pre and postnatal instructors and, you know, instructors that have a little bit more depth of information on the core, like these are the muscles that, you know, you're trying to get to. So, you know, TA, external obliques, internal obliques, different stuff like that. I mean, there's so much more, and we'll probably see on other slides. We'll be talking a lot about the rectus abdominis. And so TA, for example, transversus abdominis, we'll be talking about that a little bit today because that is important with recovery post-birth and actually during pregnancy as well. But there you can see the transversus abdominis is, it's under there, it's down under those layers, but we'll hopefully maybe try and find it today.
Yeah.
In a little functional test.
That sounds like fun. Yeah.
Here we go as well, a little anatomy review. We'll be talking about diastasis recti. I usually refer to it as DR once I've kind of said the name. So if I say DR, that's what it means. And it's just a little bit of the separation at the linea alba, like so the connective tissues that can be stretched because of internal pressure and a mixture of hormones like relaxin during pregnancy and during other things in life that can happen as well. But specifically during pregnancy, it happens in pregnant women where you can get that separation around the umbilicus or the belly button, which can affect a number of things, whether it's incontinence, it can affect low back pain, it can affect it can make your internal organs vulnerable. How if your separation is quite large, there can be some vulnerabilities with internal organs. So different things like that. So it is important to know that, especially in a postpartum fitness routine. So we can go on there. And then we'll probably be talking a little bit about the pelvic tilt. And this is really huge with anyone. But what we do focus on with pre and postnatal moms is just knowing that mind-body connection with the pelvic tilt and how you can find it, and then also during pregnancy how the pelvis does get that natural tilt forward due to a number of things, the weight of your uterus and the baby, you know, the glutes and those types of things getting turned off, so you're not really getting that strength in the back. The glutes and the low back are starting to get a little bit lazy, I want to say. And hip flexors getting really tight, so causing that anterior pelvic tilt. So we'll be touching on more of that as well in the workouts and the exercises.
Oh yes. And I'm going to chime in with some research because beneath this extremely rough, rugged exterior is a big nerd. So I like to do a lot of research and some interesting data as well. And this kind of complements, Megan, your points as well. throughout pregnancy and things like that. There obviously can be some, I don't know if you want to call like certain things complications, but some issues that can arise. And then the psychological aspect, like postpartum depression and stuff like that as well. That I'm not going to comment too much on because that's out of my scope. So I'll kind of go through what I found and consistent things I found. So I looked at a lot of studies, and these are all systematic reviews. As everyone knows, it's good high-level evidence. And I'll go through some, and I'll point a little bit to the screen. I'll point to me, and yeah, we'll talk about that briefly, and then it's all you. And I just, you know, put it to you and sit down in the corner.
Cool.
Well, no, I'll actually be engaged because I need to learn because I have lots of patients as well, and it's good for me to know a little bit more. So this article is pretty interesting. So it's called Exercise Improves Glycemic Control in Women Diagnosed with Gestational Diabetes, and Systematic Reviews. And it's pretty new, so high quality article. So incidence ranging from 3.5% to 12% for gestational diabetes affects the mother and the baby. So people got to keep in mind that it also does affect the baby. 35 to 50% increase in recurrence of this type of diabetes in subsequent pregnancy. So that's pretty high rate that if you have it once, then you're more likely to get it again. 7-fold increased risk of developing type 2 diabetes. So afterwards, there's still some risks. And then for the child, an increased risk of obesity and type 2 diabetes as well. So this article study looked at aerobic and strength training as adjunctive treatment. This is while you're pregnant. And then obviously even more benefits if you're active before pregnancy. And exercise increases glucose uptake and improves insulin sensitivity. And this is a true fact for anybody too. So if you're not even pregnant, exercise does help manage the glucose uptake. And this was 3 to 7 sessions per week, 20 to 45 minutes, and 50 to 70% heart rate max. So they're saying it's a good adjunct to care. Another study looked at quality of life. So 50% of the women in the study were sedentary during pregnancy. So 98% of women participate in only mild exercise, and fewer than 20% meet the recommendations for prenatal exercise. That's a big point that I was kind of shocked by those points. And 23% meet the minimum recommendation of 150 minutes of exercise per week. So some interesting things as well. And it showed, this one was more group-based activity. So that showed a lot of improvements in quality of life. And that was combining aerobic and strength training too. And it showed that a lot of the other things like having a community and having people to talk to about their experiences and sharing those kind of things helped too. That wasn't measured directly because that's more looking at the psychology of it. So yeah, one more is the activity guidelines. And this is from Canada. This is a really new study. And actually two of the authors are from U of A. So this hits home quite a bit. I think there's two, but I found this interesting. So anyone with contraindications, and I can send people this article, should avoid, to be careful. So this is for people that are relatively healthy. They should get 150 minutes of moderate to intense physical activity each week. That's strong evidence and should accumulate over a minimum of 3 days per week. However, being active every day is encouraged, and that's a strong recommendation. And again, with aerobic and strength training, that is a strong recommendation as well. So it's interesting to see these recommendations are kind of, looks like they looked at some of the studies that I mentioned earlier, because the 150 minutes keeps coming up, the 3 days at least is coming up. So yeah, that's like my very fast word vomit research corridor.
Yeah, and it's actually really interesting that, so one of those articles that I was reading, it does include a couple of the U of A researchers there, one of them being Margie Davenport, which she runs a lot of prenatal fitness studies, which I did take part in while I was pregnant. It was so interesting because she wanted to, they're working to contribute to keep these guidelines updated, the most up to date, and putting more research into it. So for example, one of the research projects that I was a participant in, and mind you, they don't take you until after 3 months. So your first trimester is over.
Yeah.
And then, so they don't have a lot of studies in the first trimester, just for risk of you know, risks that they're not sure of quite yet. And then they only take low risk pregnancies. So if you don't have, you know, high blood pressure, just and different other risk factors or contraindications to exercise, then they would take you. So one of them I had done was a 5 RM leg press. So they had to test kind of like where, so while I was hooked up doing the leg press machine, they had me hooked up to an ECG. My blood pressure was being taken, heart rate, and there's something else. I can't remember now. It feels so long ago. And so as I did the leg presses and worked my way up, we did, I think it was up to 85%.
Yeah.
They were studying to see like, what was my heart rate? What was my blood pressure? Oh, and then, sorry, I guess I forgot to mention. And they were trying to track fetal heart rate and different things that they could track from the outside. So they wanted to see if my body was under that kind of stress during strength training, what did it do to the baby? Because they want to give the best recommendations they can for the Canadian guidelines so that women aren't afraid to lift or even continue lifting heavy.
Yeah.
So they've been working on that, and that was a really interesting one. Especially to me, it was near and dear to my heart because coming from an Olympic lifting background, it's one of those things where it's an old, you know, thing where people are like, oh, well, you shouldn't be lifting that. You shouldn't be this. Well, you know, why can't I? Like, is there science behind it? And, you know, it's slowly being proved wrong. Like, you can continue, you know, your fitness regime that you were on as long as, you know, you have a healthy pregnancy and it's not affecting you negatively. So, for example, I was able to do cleans until a certain part of my pregnancy where any kind of jumping just wasn't happening.
Yeah.
But the snatch movement, the way that we have learned at our gym is a little bit more pulled into the hips, so right above the pelvis. And that was uncomfortable for me almost immediately when I got pregnant. It just didn't feel good, and it was just strange bringing a bar so close in that area for me. So that was a choice that I made on my own. But, I mean, to squat, I was fine. And, you know, I listened to my body as well. I found I wasn't as affected by my relaxin levels. I didn't find that my joints were really bothering me until way later in my pregnancy. And around that month 8 mark, I was like, okay, running is really not a thing for me anymore. I had to do lighter weights. Like, I just was feeling so uncomfortable. I had to listen to my body. But in the beginning, I had, you know, people, and not a lot, I just a couple people here and there saying like, well, you shouldn't be lifting that. You shouldn't be. Well, I can. So it's interesting. It really is. And the gestational diabetes as well. Like, you know, there's risk factors. Like, there might be family history. If you have a family history of type 2 diabetes, gaining weight really quick, and that's a tough one, like most women do in pregnancy. So it affects, you know, that blood sugar, the insulin resistance. So as you're growing that baby, some hormones do kind of block the production of insulin and causing the insulin resistance, and you're not able to process that sugar in the body. And so that leads to it. And then, you know, just not watching a little bit more of your diet. Like, getting pregnant doesn't mean you can just eat anything you want. You still have to try and have a nutritional diet during that pregnancy. And just, you're right, sedentary lifestyle and, you know, already having high blood pressure and even age as a risk factor. So there are, you know, physical activity does help in all stages of pregnancy and birth. So
it's interesting you mentioned all that, because I know a lot of times I get patients in, and I being like, I mean, not having pelvic floor training and things like that, a lot of patients are like, well, or clients are like, well, I shouldn't be doing this and this and this. And I'm like, actually, no, like, you should be doing that if everything else is like, and I know you'll go through some of the considerations and stuff like that. So if they don't have any contraindications, and like, have at it. And if it feels comfortable, just like how you mentioned with the snatch, it just didn't feel right, so you didn't do it. As simple as that. But a lot of people look at, like, I know my mom included, I was talking to her about Farmstrong, and a couple of the athletes there before were also pregnant. And I told my mom about it. She's like, that's crazy. Like, you should be resting and this and that. I'm like, no, Mom, like, bed rest is going to be the worst unless you have some significant complications. But it's interesting to see, like, with the new research, some people might not be keeping up with it, and then having like not old ideas, well, I guess like old school ideas, let's just call it that.
Yeah.
And then not keeping up with the data and the research. So like great points that you mentioned for sure.
Yeah. Yeah. So it's definitely, they're still, they're still working on that research and still getting more education, and just education to, not even just trainers and strength coaches, just, general population, and on what is good. And again, there are going to be absolute contraindications to exercise. You might have an incompetent cervix, and you've had a number of miscarriages, and your doctor says like, no, like, rest is essential for you. And that's something that as a trainer or physiotherapist, we wouldn't go against that recommendation. Like, obviously that is going to be a huge thing. And there's a number of other things also, and I won't go through them too much, but it's always good to have like a team.
Yeah.
Brittany was saying earlier, it is important. It's the team of the doctor, the physiotherapist, maybe there's a chiropractor involved, like, and the trainer to work together to create that full healthy lifestyle. So it's super important for that.
I can put on the next slide here if you like.
Sounds good.
That. I was assuming that was my cue.
Yeah, I already moved mine over.
Yeah.
Okay. So as a trainer, strength coach, group fitness instructor, there are definitely considerations when working with a postnatal fitness client. And these are some of them that I have down. But definitely not all. So I'm sure we're going to get some questions about different things as well. The most important thing, though, as trainer, instructor, group fitness instructor, is to get a full health history as much as you can. There's the paramedics for pregnancy. So if anyone knows that someone is pregnant, even if they've had a client for years before and they know a pretty good health history of them, the day that they are told that they become pregnant, they should be getting a paramedics for pregnancy filled out by their doctor. And I know that there may be costs associated with it at times, but it is important, and it's important for the liability of the trainer as well. That trainer shouldn't continue working with them if they don't give them that information. So it is super important. And most trainers, even if they are not pre and postnatal, certified or have a lot of experience with that, they can still work together. They probably have enough education that if they were to get, reference information from a doctor or a physiotherapist, they probably would be able to implement a very safe program. And I would say most trainers and instructors would do some kind of research to make sure that their clients or class participants are getting the full amount of benefit from their class. So we'll start out. So dysfunctions that, someone that's pregnant could present with, or not, they might not even know, is what we had talked about before. So diastasis recti, so the DR. So it's that, that potential separation at the linea alba that holds, the two sides of the rectus abdominis together. So right around the belly button and the umbilicus. So the reason why a trainer or group exercise instructor should know about that is there are a good amount of exercises that the trainer should avoid programming, at least for like a 6 to 8 week period, until they start to see maybe some progress in maybe the area comes back closer. Sometimes it doesn't, or maybe just being able on their pelvic floor health, transverse abdominis, being able to like have that mind body connection to the other parts of their core and slowly getting stronger. There is a DR test that I will show that you can try at home. Again, it's not a diagnosis, but it is a little home test that trainers can get their clients to do to see if maybe they might have it. But some considerations, again, to help that area heal, or the rectus abdominis heal for a while, would be to avoid anything like that would be straining that muscle. So we're thinking crunches, sit-ups, plank, you know, anything using that kind of forward flexion of the abdominals. Even something like, I have a list here, but you know, there's even times where if someone is at risk or they're maybe in month 9 and they already know that they've got some abdominal separation happening, even as something as simple as getting up from a lying position is like trying not to do that full flexion forward and just rolling to your side and then pushing yourself up. So there's a lot of considerations that a trainer would have to think about for that to help with healing on their journey back from postnatal into back to their fitness world.
Yeah.
So the next one, another one that trainers should really know about is pubic symphysis separation or pubic symphysis dysfunction. So sometimes during pregnancy, the hormones in your body really start to, where your pelvis comes together and you've got that little cartilage area in between where the bones come together. That becomes a little lax sometimes, and it can give pain to moms, especially when they're pregnant, or even when they're like in their 3rd or 4th pregnancy and their body knows exactly what to do. You know, they always say that like the moms start popping earlier on their like 2nd, 3rd, or 4th pregnancy because their body, like their ligaments already know, okay, it's time to stretch out. Like their body knows what to do. So they start maybe feeling some pain in that area. And after pregnancy, especially if during the birth and if it did come apart. So yes, there's an ability for the pelvic bones there to come apart to get that baby's head and body through. And it can really bother postnatal moms for a good amount of time. So what trainers would need to know is they're avoiding split-legged motions for a while. They might be avoiding exercises with the adductors, so pulling the leg into the body, because that's going to really bother that area. And that area, what it needs mostly is rest. So you'd be maybe prescribing, you know, if you're doing any kind of strength training, you might be doing a little bit more focus on the upper body, maybe not as much split-legged work. You can see if squats might feel okay. You might be more in the water if you do have access to a pool, or even something like more bike riding. And again, that's so unique to each client because that still might not even be comfortable for them. Mm-hmm. And I did have someone with that was pretty, the pubic symphysis dysfunction was pretty intense for them. It was really tough for them to get back into fitness after that one. So it is pretty real. Referring back to the pelvic floor presentation you had last week. So there's multiple ways you can live with some kind of pelvic floor dysfunction before and after pregnancy. So that pelvic floor being that net or that area where, you know, excretion of the body happens. So that group of muscles down underneath, under the pelvis, you're sitting on them right now. You can have many different ways that they are not functioning properly. And whether they're weak or whether they're tight, hypertonic. Most trainers, if they don't, if the client does not come in with a diagnosis from a physiotherapist, we just always assume that it's weak, especially postnatal. And that's just what it is. We're not ever going to be able to diagnose. We're not going to be doing internal exams. We have to, and that's why the team is so important. We need to know this from a pelvic floor physiotherapist, you know, what we're working with. But, you know, if someone's coming in and saying, you know, I've had my baby, I'm 8 weeks post, and I still feel a bubble after I run. Like they feel like they have a bubble feeling in there. Like you have to really be aware of that and then work on exercises to get back to that. So maybe you're doing more mind-body connection to the pelvic floor, and there's different exercises and cues you can use with that, or helping them find the TA, the transversus abdominals, and how to activate them and turn them on. And you slowly have to work on that.
Yeah.
So that is another big thing. Actually, it's one of the main things that really help everyone. And then getting back into anterior pelvic tilt, really affecting low back pain. The trainers would then really focus on glute activation or reactivation, and then stretching of the hip flexors in front to really help with that pelvic tilt. Kyphosis, like the really like hunched back, which most moms find comes with neck pain and back pain. And that one, it comes with pregnancy, but also mostly after birth. When you're holding baby, whether you're breastfeeding or not, you're still getting it. You're holding that baby at all times. And all my mom friends, they know that some days, you know, in the first 3 or 4 months, it's like, all I've done is hold my baby all day, because that baby just wants you. And it's painful. It's painful in the neck. It's painful in the back, even though it's beautiful. You get stuck in that position. So that's a huge thing for trainers and physiotherapists to think about.
That's good.
Yeah, it's huge. Even something as simple, and I guess I'm going off topic here, but no, I'm still on topic, but I'm off the topic of this. But so something as simple as ergonomics of pushing a stroller. So you think about, you're holding that stroller, you're in this position, you know, you got to bring those shoulders down, you got to relax, roll those shoulders back. And then we have so many we have a stroller fit class, we have a lot of mom and baby classes, and some do involve strollers. But when I teach those classes, and the instructors that I generally have that teach them, we really encourage moms who are able to start running to run without the stroller, especially in our classes when baby can be, you know, supervised by a trainer or whoever's around them. Because ergonomically, like, let's run how we're naturally supposed to run. If we got to run outside with the stroller, okay, we'll handle it. We'll try and do the one hand. But like, let's encourage like that healthy neck, back, and shoulders, and let's run ergonomically correct, because us running with a stroller is not.
No.
So that's a huge one. The next one is like, it's tough because not everyone wants to talk about this one, especially in a personal training environment, is hemorrhoids, or even like tearing after birth and having stitches in that area. So the perineum also needs to heal, and that's a huge thing. So a thing a trainer might want to do is really think about programming a little bit more. I have isometric versus dynamic, but what I meant to more say is looking at more of a reps-based approach versus an isometric holding area for hemorrhoids, because you want to promote blood flow to the area, so movement, but you don't want to promote a blood pooling. So for someone that's suffering with a hemorrhoid or hemorrhoids, you might be then proposing them to do just like squats with a ball and a wall, versus holding a leg up. What's the word when you sit? The wall squat, or like the wall sits. There we go. Yeah. Versus holding a wall sit, because that's not going to feel very good. It's going to bring a lot of blood pooling to the area for like a hemorrhoid or a tear, and it's not going to be a good situation. So stuff like that we would be taking into consideration. And then, so research is still trying to figure out if so relaxin in the body, it's a hormone that's produced because of progesterone increasing in the body during pregnancy. It then secretes or helps stimulate relaxin in the body, which helps your body relax the ligaments, relax areas, so it's getting you prepared, or it softens areas to get you prepared for birth. But whether it drops off the moment your baby leaves your body, or whether it stays in for a couple months, there's not exact there is some like research, but there's not an exact point in time where people can say, okay, that relaxing's gone. So it might be still lingering in the body, and maybe it has ties to maybe how long you're breastfeeding. Maybe it has ties to what number of child you had. But a big thing for trainers and even yoga instructors as well to be aware of is the overstretching of the joints and joint pain, and also for physiotherapists to know, because they still might have evidence of relaxin in the body. And so just being aware of that overstretching of the area, or for myself, I was getting considerable knee pain on top of the knee pain I had had before. And I think it was attributed to that, probably as well to weight gain over pregnancy. But,
Yeah.
you know, as I've gotten farther away from the birth of my son, it felt much better. So I don't know. I don't have an exact test to tell me if there was relaxin in my body for a while, but it's quite apparent for some people. So
Yeah, like this list question right here. I still have relaxin issues, 3.5 months post exclusively breastfeeding. So still haven't
yeah.
released. Yeah.
Yeah. So like that's a huge thing. And I think a lot of people are doing research on that to see, like, you know, is the difference between like exclusively breastfeeding moms versus formula fed babies, like what, you know, it's so hard if you've got such different lifestyles to really compare that unless they're taking consistent, I guess, blood tests. I haven't been able to find research to really give me a pinpoint, but maybe someone does have some. I would
that
love
I do not know. I don't have that fact offhand. So,
yeah.
and then another question: what resources, specialists that are available to a new mom? Who should they seek out to speak to? Like, I know there's one. There's a couple of physios in town. I know Mother Nurture. If you look at their website, they're a great resource, and there are physios that work with you throughout the duration, or just after or before. And it's good to get in touch with them to get some information. Do you have any resources as well, Megan?
For resources, I mean, I would mostly like, it would be like physiotherapy stuff, but for me, I know that as a trainer or like a pre and postnatal instructor, during pregnancy, it's hard to correct that because your pelvis is just tilting and tilting and tilting. It's growing. But to give you some release or relief from that back pain, doing things like cat-cow.
Yeah.
So moving through that arch and really thinking about the pelvic tilt, really trying to control the pelvis, going through that cat-cow will help you get a little bit of relief. Some child's pose position, if you can still get into that position.
Yeah.
Doesn't mean your hands or forehead have to be right down to the ground, but that really helps take some pressure off the low back. There's a really amazing yoga instructor at Service Place, and she showed me a really nice posture that you can do with a partner where mom leans up against the wall, kind of in I think it's a camel pose, and hips are out towards the center of the room, and the partner then squeezes the hips together, and it's really nice. It feels good for lots of people, kind of in the joint, the SI joint area.
Yeah.
So there's some ways to help like alleviate the back pain a little bit, and then also to stretching out the hip flexor area, the iliopsoas and stuff as much as you can. So that can sometimes help alleviate it. So
yeah. And then another question, sorry to rattle these off, but some of them were from quite some time ago, and I was like, I'll just wait for a different time. Just briefly, what's the most common barrier to activity for pregnant or postpartum clients so far, and how do you approach that?
the biggest barrier I found for pregnant women, okay, so two things. I would say the belief that physical activity is not good for them to do during pregnancy. I would say that's more of an old thought now, but that's a little bit. For me personally, was my first 3 months, I was so sick. Like I could barely get to work and then get home. So that's another barrier. And then, you know, once you've not been active for 3 months, it is so hard to drag your butt back into the gym or some kind of activity. It's like, you just, you do feel a little bit more normal in the second trimester, but it's tough. Like everyone has that issue, whether they're pregnant or not. Like if you've been inactive for 3 months, like that's a challenge to hurdle over.
That'd be tough. Like even just not like for me, not being pregnant, obviously, and being inactive for like a month or two, I could only imagine what would happen after your body goes through significant changes. So
yeah.
Yeah.
Barriers postpartum, and I've definitely lived through those, is like lack of sleep, lack of time for yourself, lack of hydration or nutrition. it's, you know, your life is now taking care of this other life, and it is sometimes hard if your spouse especially maybe works out of town, or you don't have family and you can't really get away for a little bit of me time. That's been a big barrier. And then I would say also maybe dealing with this dysfunctions that we've listed here, and just not knowing who to go to for help, and just living with it, I guess, as you'd say. Maybe a lot of people's grandmas or moms may have just lived with it, and I don't think people have to do that. So there are places to go for help.
You can ask your OB, like ask the physio that you work with, or find a physio and ask them. And like personal trainers as well. Like there's lots of resources out there. You just gotta ask one person and kind of just continue from there. Yeah, those are great points. It's good for the other sex as well that's watching to learn a few of these things as well, so they kind of know a little bit more about the process and how big of an impact it is, because some people might not understand that.
Yeah.
Yeah, so I think it's a great flow of discussion for sure.
Yeah.
There's multiple more questions. And then for the exercises, I was going to say, just because we're having such a good discussion, if we could do one next week or something like that as well to go through just the exercises would be great.
Yeah, I'd be up for it.
If you'd be game, and I know I said that to somebody else before, I'm like, I don't want to put you on the spot.
Oh, no. I actually see a really good question right here. So what are some of your go-to exercises for someone with a diagnosis? So, and it's funny because I do have them all a bunch listed here.
Yeah.
So a big thing with that is, again, avoiding those plank areas. But I really like, so if you still want to work core per se, side planks, like starting out on a basic side plank is really nice. You're really hitting those external and internal obliques, but then you're also able to rest the rectus abdominis, so that's really good. Again, anything with glute activation, helping you strengthen the glutes, but then also kind of around that core still. So doing pelvic tilts, or like I like to call them, like tilt the teacup. So laying on your back and playing around with your hip bones. So hands would be on your hip bones and you're tilting the pelvis back and forth. You're really getting awareness, bringing awareness to that pelvis, tilting it back and forth, and then bringing it up into a bridge. So hip bridge, or like hamstring push-ups I like to play along with. So just working like the posterior side of your body and the lateral side of your body, and letting that interior side rest a bit. Then also what we would probably get into a little bit more is actually pelvic floor activation, maybe even next week, but learning how to do how to activate your pelvic floor. So bringing awareness to that area, maybe thinking of the elevator, so pulling it up. I also like to use like the jellyfish terminology, so pulling it up like a jellyfish, and everyone has different cues that really resonate with them. For example, mine is the jellyfish, but some people like the milkshake. Some people like the picking up the Cheerio from the floor. So there's a lot of different cues, so many to help you resonate, find that pelvic floor. So.
No, it's interesting. Milkshake's interesting.
Oh yeah.
And I know, like Jenna and Brooke, I know there's lots of good questions, and we can, like, if we could do it next week where everyone's just doing the activities while we do it, that would be great. I can bring some.
Yeah.
I have gym strip every day anyway, so I can do all these with you. You can comment on my performance of these, but I think that'd be great if we could just do like an exercise day.
Yeah, that'd be really cool. I'd love to do that. We can do some pelvic floor activation. Yeah. We can find our TA. We can do a test for DR. Like there's a lot of little tools that I have. So.
Because that's what I discussed. I'm like, this is like going to be a common theme. So I'm like, actually, it's great if it could be like multiple weeks. So, yeah, this is awesome. Like, quite a few things that I'm learning too, which is awesome. I like always working with other individuals. So like having like a good referral source, like yourself, for instance, having someone manage that physio, and then going into training and doing like graduating onto doing more rehab stuff, right? So here kind of manage the immediate things, and then a professional like yourself starting to get a bit more work done with that particular population, or anyone really. But it's good to see a pelvic floor physio for sure, like from our end of things, and just whether it's one session or not. Like I know the Mother Nurture business that I talked to you about initially, and then a lot of clinics have pelvic floor specialists, but I think it's good just to get a couple sessions with them, because sometimes it's just a matter of, like, if I treat someone for a minor injury, I see them once or twice, and then they have enough tidbits to go utilize that education and then kind of continue the rehab process. So it's good that you have the level of training that you have and the knowledge, like quite a bit of knowledge about this area specifically, which is awesome. Like I kind of feed from that energy. So it'd be good to like link up and work together a bit more in that aspect. I know, again, I'm not a pelvic floor physio, but I have seen it, many women for issues with the SI joint and back and things like that, and wrists as well. So not the internal stuff obviously, but like it's cool that there's a team. Like previously I worked at a place that I saw somebody for back pain, another pelvic floor physio saw her for other things, and then like had her chiro. Like it was just a sweet team that, and had a trainer as well. So we all linked up and did a lot of work together. So that was good.
That's awesome.
Yeah, sorry. I tend to talk a bit more than I'd like to.
Was there any other questions we can answer before we wrap her up?
Yeah, this is good, because it's like, this could be the lecture period, and then the next week would be like the lab, and the lab would be the gym.
Yeah, everyone's coming back to university.
I'd call it the movement lab, but that's a business downtown, so I don't.
Oh, there
A
you
great
go.
CrossFit gym. A great CrossFit gym. It's close to my house. Yeah, so if there's any other questions, type them out. Or guys, next week we'll come up with a schedule and maybe do like a whole exercise day, and then you can ask more questions at that time as well. Yeah, definitely like a really good.
I just want to, there's a couple questions here. I just want to see, what are cues do you use to get clients to activate TA versus rectus abdominis? Yeah, so like, I just want to go through quickly. So TA, what I would generally do is I'd get them to lie on their back. I'd get them to find where we could find TA from the outside, finding the hip bones first. So laying on your back, finding your hip bones where they protrude, and then going slightly inwards, trying to find a soft spot in there. So it's easier to see, and I do have we'll be able to show next week. So then what I like to do is either try and get them to cough and see if they have something pushing back on their fingers, or I try and get them to blow out like 100 candles on a birthday cake and see if they can get that feeling to push back on them. And if they can, great. Sometimes I get it where they can't find it and they're just still not able to connect to that. So then I try and refer to them thinking about a nice tight corset wrapping around their core area or their trunk area. And sometimes they are able to resonate with that. But yes, it is, I find it is hard at first to try, especially someone that maybe doesn't have the background of connecting with the TA versus the rectus abdominis. And I would be the first to admit that I think it was like 10 years ago when I first played around with Pilates. I was that person where I remember the instructor being like, no, Megan, you're still turning on your rectus abdominis. Like, don't turn that on. So it's difficult for some people, and you just have to have different tools in your toolbox to help them find that.
It would be
I'd love to hear other cues, but
men can do it too. So it's kind of interesting in school that we learned that. I know Instagram's giving me the 40-second warning, but
okay.
I know Brittany actually just said, fantastic presentation. I wish you lived in Toronto. Sorry, Megan is Edmonton's. So that's great. So yeah, that's great. Brittany got a chance to see this, and then next week we'll do another topic, and we'll discuss what day that would work best later. I want to thank you so much, Megan, for doing this. This is amazing. Like, gives me so much energy as well and gets me jacked up as a physio. So like, really appreciate it. 10 seconds. Thank you.
Well, thank you so much for having me. Maybe we'll do we'll do this next week or the week after, whatever you can fit me in. So
for sure. Oh, got a second. All right. Bye.